Most of us imagine a man suffering from a heart attack, and in fact, adult men have higher heart attack rates, but once women reach menopause, women's rates skyrocket.
In fact, in adult women, heart disease is the #1 killer.
I had a brother, yeah, he passed at 43 from a heart attack. And then my father had open heart at 47 and has since had multiple heart attacks and multiple stents. My mom had a heart attack at 47.
Beth is a WellSpan patient who has a very strong family history of heart disease. She's also menopausal, which causes a drop in estrogen levels in the body.
We know that estrogen keeps blood vessels pliable, it slows the formation of plaques, and so when a woman stops producing estrogen, changes happen in her blood vessels, and that all is one factor that can lead to heart disease.
Beth was showing menopausal symptoms and symptoms of heart disease.
I was having some chest pain. It actually was starting around my scapula.
But she was displaying another menopause symptom that's often a red flag.
Hot flashes, and then that correlates with not sleeping. You're emotional, you're up all night because one minute you're hot, one minute you're cold. And even throughout the day. It feels like you start to get hot from this, like your center, and it just radiates to all your extremities.
Women that are more affected by hot flashes happen to have a higher incidence of heart disease later in life.
Fortunately, there are things you can do to lessen the risk.
Now we know that in the appropriate candidate, when estrogen therapy is started soon after the menopause transition, the risk is extremely low, and there is emerging data that it actually can slow the progression of cardiovascular disease.
Beth wears a patch that restores estrogen loss caused by menopause.
With the estrogen, the heat flashes are controlled. They're still kind of occasionally, but not like they used to be.
For Beth, this health issue hits close to home, not only because of family history, but she's an open heart OR nurse at WellSpan York Hospital. Take her advice, and that's to maintain regular checkups with your doctor.
They know, okay, this was what you had when you were 50 years old, but now you're kind of symptomatic. Let's take a look at it again, and just staying on it, because you're not good to anybody if you're not here. That's where my mind went. I'm not good to anybody if I'm not here.
Ed Russo, CBS 21 News.